Welcome to this episode of Nursing Edge Unscripted, Saga, a conversation where we journey through the history of nursing education using stories that connect the past to the present and then our future as we reimagine our teaching and learning. June is the birth month of Carolyn Van Blarcom, born on June 12, 1879. Carolyn is remembered as the first American nurse to become a licensed midwife. Carolyn attended Johns Hopkins Training School for Nurses. Having been struck with rheumatic fever at an early age, her early years in training were difficult, and yet, despite her health, she graduated with distinction and was invited to join the school's nursing faculty, where she devoted her teaching to obstetrics. Eventually, she became the assistant superintendent of the school. She moved through her career in various leadership roles. In 1884, Carl Creed publicized the effectiveness of a 2% silver nitrate solution in preventing Orthomia neonatorum. This is an eye infection that occurs within the first 30 days of life and is caused by contact during birth when the fetus descends through a birth canal that is infected with a sexually transmitted disease. This treatment was revolutionary since in the 19th century, the incidence of neonatal conjunctivitis was the main cause of neonatal blindness. Carolyn is responsible for implementing the treatment for this condition with silver nitrate in the United States. She led a national movement to educate other nurse midwives in the United States who were unfamiliar with the procedure. Today, this practice is the standard of care across the world. Concerned that the knowledge and use of this treatment needed to become part of the care practices across midwifery, Carolyn launched an obstetrics nursing study in the United States, England, and 14 other countries, supported by a grant from the Sage Foundation. She published her work in 1913 in the publication entitled The Midwife in England. Carolyn was quoted as having concluded that the United States was the only civilized country that did not protect its mothers and infants by providing for the training and licensing of midwives. Carolyn was appalled by the lack of rigorous measures to assure the safety of midwifery care. She became the voice for modern-day midwifery for her tireless work to reform midwifery in the United States. She was the first American nurse to be licensed as a midwife. Through her leadership efforts, she raised awareness through her writing and speaking across the healthcare community on the importance of educated and licensed midwives. Some of her popular writings included Building the Baby and Getting Ready to Be a Mother. She established a midwifery school in New York City in conjunction with Bellevue Hospital, and in 1911, it became the first midwifery school of its kind in the United States. Carolyn's passion was to work to prevent blindness, and she channeled this work through her appointment in 1909 as secretary of the New York State Committee for the Prevention of Blindness. She investigated the causes of blindness and educated the public about prevention and treatment. Her role afforded her the opportunity to launch and execute campaigns in ways to prevent blindness. She continued her work and in 1916 moved to Illinois as secretary of the Illinois Society for the Prevention of Blindness. Her connection to nursing education today can be found in her work during the 1920s, where she channeled her energy toward editing and writing. She created the textbook for obstetrical nursing in 1922. Her writing, in association with her keen ability to organize curriculum that was evidence-based for delivery of high-quality midwifery care standards, is a testament to today's standards and guidelines in preparation of the modern-day nurse midwife professional. Carolyn's battle with her own health was a lifelong struggle, and unfortunately, to her disappointment and dismay, it was her illness that prevented her from later working at all. She died of bronchopneumonia at the age of 80 on March 20th, 1960. Reflecting on Carolyn's life and work, we can make a strong connection to the importance of evidence-based practice and how this informs the standards that guide education of today's professional nurse. Today, more than ever, the delivery of safe, high-quality care in our acute care and community settings is best served through the knowledge and use of evidence. Carolyn was quoted as saying, quote, "The nurses whose skill is warmed by a sincere desire to give of their best will, by virtue of this very desire, learn something from each patient and will be steadily enriched and broadened by their experiences." Unquote. Carolyn gave her very best to causes she was passionate about, and this passion connected her to the patients she served. She listened to understand, reflected on, researched, and then shared her knowledge through her writing and dissemination of the science that improved the art of midwifery. Her legacy continues to inform the advancement of both the science and the art of nursing practice and education still today. Carolyn Van Blarcom, a tireless researcher, writer, teacher, and leader, forged a path for today's modern nurse midwife. And so the saga continues. And may our saga continue as we bring to a close this episode of Nursing Edge Unscripted, Saga. Thank you for joining us. And remember, good teaching doesn't just happen. Find your fit, push the boundaries, and celebrate the ahas.